Hello there. As coronavirus cases continue to rise in India, today I want to talk a little bit about geographical concentration because it's becoming increasingly clear that the coronavirus crisis in India is increasingly centered around 2 or 3 cities. Well, there's Mumbai, obviously, Delhi, Ahmedabad, to some extent Indore, Pune, Thane. A few cities are where most of the problems are. And that picture becomes really clear when you look at the map of India and you take a look at the fresh cases that are coming out every single day from a handful of states. And we know which those states are for fresh cases. Let's take a look at Maharashtra, for example. Just yesterday, something like 1,089 new cases in Maharashtra, 390 new cases in Gujarat, 338 new cases in Delhi. And Tamil Nadu, a fairly new entrant to this, maybe because of that one super spreader event that took place in Tamil Nadu, but 600 new cases in Tamil Nadu. Now put that together, it comes to 2,417 new cases yesterday just from these 4 states. That means more than 70% of the fresh cases we saw in India yesterday were from just these 4 states. And this has been a pattern that's been there for a few days. The day before yesterday, it was nearly 80% of all new cases from these 4 states. So this is where the concern is. Now, when you look at numbers of deaths that are taking place, the picture is slightly different. A really high concentration in 2 of the states that I've been talking about, Maharashtra and Gujarat. If you look at Maharashtra and Gujarat, 97 people died yesterday in India. 61 of them were just in Maharashtra and Gujarat. So about 65-66% just in those 2 states. Delhi and Tamil Nadu are 2 states which are seeing a large number of cases, but not too many deaths. In fact, hardly any deaths. So everyone who gets coronavirus, about something like 20 to 30 people are recovering in Delhi for every person who dies. The worrying states when it comes to deaths, in addition to Maharashtra and Gujarat, are West Bengal and Madhya Pradesh. There have been 200 deaths so far in Madhya Pradesh and 160 deaths that have taken place in West Bengal. So put together, Maharashtra, Gujarat, Madhya Pradesh and West Bengal account for more than 70-75% of all deaths that have taken place in India. So these are the places that need to be thought about, that need to be worried about. You need to prevent coronavirus from going to new areas, but these are the areas of concern. Here are all the big stories this Saturday.
In a decision that will cut down India's need for COVID-19 testing kits, the Health Ministry has said that mild and moderate cases do not need to be tested prior to discharge. As per the earlier policy, patients had to test negative twice prior to discharge. Even for severe cases, the patient would need to test negative only once at discharge instead of the earlier twice. According to Health Minister Dr. Harshvardhan, the testing capacity in the country currently stands at 95,000 per day. The target is to do 1.2 lakh tests per day. The Ministry of Health on Saturday said that over 15 lakh COVID-19 tests have been conducted in the country so far. In a tweet, the ministry said more than 15.25 lakh tests have been done till now. India's per-day testing capacity has jumped to 95,000 and more than 84,600 tests were done on Friday. The ministry said there are 453 COVID-19 test labs functional as of now.
With Gujarat reporting a continued spike in the number of COVID-19 cases and fatalities, the centre has rushed medical experts from AIIMS to Ahmedabad. The AIIMS team, headed by its director, Dr. Randeep Guleria, will provide expert guidance to doctors there on COVID-19 management. Of the over 7,500 coronavirus cases in the state, over 5,000 have been reported from Ahmedabad district alone. Union Home Minister Amit Shah on Saturday said that the centre is not getting any support from the West Bengal government. In a letter to West Bengal Chief Minister Mamata Banerjee, Shah said that the state is not allowing trains with migrants to reach West Bengal. Not allowing trains to reach West Bengal is injustice with migrants. This will create further hardship for them, Shah wrote. India has reported a relatively small number of coronavirus cases because it acted quickly, World Health Organization's special COVID-19 envoy Dr. David Nabarro has said. Speaking to NDTV, he said that the pandemic will hit its peak in India in July end before being contained. He added that there will be more cases when the lockdown is lifted. Referring to the nationwide lockdown, Nabarro said India, because of its quick action, has managed to limit the pandemic to specific areas. At the daily briefing on Friday, Health Ministry Joint Secretary Love Agarwal said it's important we learn to live with the virus and practice behavioural changes. The government advice came as coronavirus cases came close to 60,000 on Saturday, according to the Health Ministry data. COVID-19 deaths in the country are nearing 2,000 now. Odisha saw its highest single-day surge of coronavirus cases so far, reporting as many as 78 new cases on Friday to take its tally to 287. The state has been reporting low numbers of coronavirus infections till now, but in the last 2 days, 107 cases have been discovered, mainly amongst the migrant workers returning from other states. More than 80% of the state's cases, 240 of the 287, are concentrated in the 5 districts of Ganjam, Khurda, Jajpur, Bhadrak and Baleshwar. These are the areas that have received maximum number of returning migrant workers.
Kerala on Saturday announced it had flattened its coronavirus curve. The state crossed its 100th day since its first COVID-19 case was reported and currently has only 16 active cases, Kerala's Finance Minister Thomas Isaac tweeted. Kerala was the first state in India to report a positive case earlier this year. Since then, state officials have worked on aggressive isolation and treatment protocols. Kerala is preparing to receive thousands of stranded citizens, mostly from the Gulf, as India embarks on a major repatriation drive.